without further ado, I'm very proud of my association with Emina Karamanovski, who is my hair transplant coordinator. She's actually a physician from Serbia as well. And she's developed a lot of unique techniques that we wrote together in a book coming out about phase 1 and phase 2 training that she's going to be working with the in St. Louis. And really what is so unique about this is oftentimes you go to meetings, it's like assistants over here, surgeons over here, you don't know what you're doing. This is the first time we're integrating both, and you can learn from both sides. Both your assistants as well as you, and your assistants can learn more the surgery side, and you can learn the assistant side. So very, very proud of what Emina has delivered here. So, and Emina flew all the way here for one talk. I asked her to come, and she's flying out.
I have been training assistants all over the country, here and in Canada. And what I found the most difficult for a physician who is starting hair transplantation is to train assistants, because you cannot do good hair transplantation if you don't have good assistants. And so once you're starting in your own aspect of doing transplantation, you don't have time to look at the assistants if you don't have a good structure for the training. And that was the reason for this presentation. And so the objectives of today's presentation would be to identify the training challenges, learn the purpose of pre-patient training. I developed something I call pre-patient training or phase 1 training. Usually hair transplantation is trained on a live tissue, and the difficulty when you start working, you don't have tissue you can waste for the assistant to train. So there's a specific challenges in hair restoration that will be addressed during this pre-patient training. Then you're going to learn 2 objectives, 2 specific goals in the training, and about the training itself. So the most challenging part is this training on a live tissue. So if you have an assistant who is in a room and the patient is in the same room, there's a difficulty of asking questions. They don't want to look ignorant or scare the patient. And the other thing is they don't want to damage the tissue. So those are 2 challenges that I find the most difficult in training a new person. So for that reason, I developed the pre-patient training. So when you're hiring someone, you want to look for 2 characteristics they're specifically needed in hair restoration. That is manual dexterity and the capacity to work to do the tedious work. In a manual dexterity, I look for person being skillful to do tedious work and they have good eye-hand coordination. And the other thing is hair restoration is a procedure that lasts for hours, so the person has to be able and willing to sit for hours and work in with a microscope, so it requires a stamina. And the mental aptitude for tedious work requires knowing what someone is doing, but also having a critical knowledge and constantly monitoring what they're doing, because every move of a scalpel, like anything else, can damage the tissue and impact the end result. So the phase 1 training, usually starting in a transplantation, you would ideally have someone who's already trained to assist you in a surgery. But if you have someone of your own staff that you're training, then you want to divide into the training that would take a few weeks, which will be just developing the basics of hair restoration, and then several months for someone to develop the skills. So the phase 1 would be learning about the procedure itself. We're looking at the big picture, what the hair restoration entails, and so each assistant has to know the big picture of the hair restoration. Learning about specific tasks, which would be teaching about instruments, handling, also cleaning the instruments, clean technique, and so on. Then practicing cutting and placing technique on a special foam that I will show you later, and then observing the procedure so they can integrate what they learn in this training and what they observe in a procedure. Phase 2 training would have assisting in the surgery, so the assistant will learn how to assist you and support you, then learn about graft dissection and graft placement. So the purpose, once again to repeat, the purpose of the phase 1 training, which would be to eliminate the presence of a patient and additional stress on a trainee, and to develop skills, awareness for the technique, and start developing critical judgment. So the phase 1 training, which is a pre-patient training, and this will be the main focus of my presentation in this presentation here, is we use a dummy and the person will practice cutting and placing on a styrofoam head so they can understand what they are supposed to do without being stressed of the presence of a patient or damaging the tissue. And the other part of this training would be practicing on visualizing slivers so they can visualize what they are supposed to do before they touch the tissue. So I have a special foam that I use. I position instruments, which would be a tongue blade in a forceps in a blade, and a person will start cutting the foam. And the objective would be to hold the blades steadily and not crushing the tissue, because if it's so easy to use the foam, if the person squeezes the foam too hard, the foam would lift and will show that they are doing something incorrectly without really damaging the tissue. If they're pushing the blade too hard, they will be marked in a tongue blade depressor, so you as a physician can stand, or someone who is training your staff can see if the person is doing something incorrectly and adjust that action before the tissue is introduced. So the person will sit for 20 minutes and cut the foam, create the even slivers so they can develop the skillfulness in eye and hair coordination. And then we will use a styrofoam head to put it in a patient chair, and the assistant will learn how to position themselves and how to insert the foam inside of the styrofoam head and understand the entire concept of how to put the grafts on a hand and how to introduce them into the site. And then we start thinking about looking at the instruments, as I mentioned earlier, the way the person is holding the instrument. There's every action can impact the end result. If the assistant is crushing tissue with the forceps, then the end result may be a kinky hair or unnatural look. If the tissue is handled in such a way that either the person is scraping the tissue with the blade or once again holding it firmly with the forceps, it can affect the end result if the tissue is not moist. So there's a certain actions that assistant may do in a wrong way that impact the result. So you as a surgeon can do everything correctly, but you also have to know what your assistant is doing and guide that to a higher quality control. And then body positioning, if the person is cramped and slouching, they will be less productive because they're going to be tired sooner. Or how they position vis-a-vis the patient. Patients are awake for most part of the procedure where they are placing grafts. So if the assistant is positioned in front of the patient's face, so there's a certain positioning and body positioning that is important to know in order for the experience to be good for the assistant and the patient. Then I use photos as a second part of my training, where I take a photo of a strip, and then I show where the slivers can be made. So the assistant will start visualizing, and I would print out this photo, and then the assistant can take the pencil and draw the line where it will imagine making cuts. Because that is the hardest part in assistant's job, is to know where to do the cut and because the hair doesn't grow in regular patterns. They will be always a little bit off pattern, so they have to make a judgment where to cut. And then on the right hand side, I'm showing what the sliver looks like, so they understand what the objective is, so they can take a strip sliver and they can visualize every step of the procedure. Then from each sliver we dissect into single follicular units or 2 follicular units graft. So once again, they will visualize within the sliver how to cut in order to obtain specific grafts. And the critical thinking is to start being aware of person's actions and how they can impact the tissue and end results. So the person will learn how to handle tissue gently, how to keep tissue moist all the time, and how to create a clean dissection. What that means is no cutting through the hair shaft. And what not to do, and that is transection and allowing graft to dry. I also take pictures of bad grafts or ugly grafts, so the person can develop the awareness of what not to do by comparing. So on the left hand side, you're going to see the grafts that they are not good, and so this is cut too short, there's a transected hair, This then doesn't have a hair bulb, so it should be trimmed. This one doesn't have a hair bulb. So all these grafts, for example, these two are all transected. There is no hair bulb, so there's no purpose of transplanting this piece of a tissue because it won't grow. And so the idea is to take grafts that don't look good compared to the grafts that look good, so the person can start developing critical judgment. And the same thing here, another point to make here is that the grafts should not dry. If they dry, they don't grow. So I have a picture of matte look, so there's no glossy, shiny look to the tissue, which means the tissue is dried. If the assistant leaves the tissue on a dissecting board too long or on a hand without spraying it, hydrating, the tissue will dry out and the end result may be poor growth or no growth. So the tissue should not look dry, it should look shiny, and this is transected plus dried out tissue. So I wanted you to see what it looks like, what it shouldn't be done, in order to know, to guide your assistant how to do this correctly. I also did, at the end of my training, I take this image of bad grafts and then ask the assistant to look at this and tell me what they think they can make. So at the end we have results like this. The first tissue, this one is cut off. There is no hair bulb, so this cannot produce a clean graft. These are too short. If transplanted, they may sink too deep in a site, create ingrown hair or cyst. This can be cleaned up. They has to be trimmed and cleaned up to make a single hair, because this one is transected. This one has also one graft that will have two hairs. All these, this one has to be trimmed off, this one has to be trimmed off. And so, for example, this tissue, we don't even know if there is an intact hair to keep. So the idea here is to see how many grafts can we make from a tissue and make sure that all grafts look clean. So the objective of pre-patient training, so spend a week or two with your 2 weeks with your assistant where they spend some time cutting the foam, understanding the basics, practicing their hands, looking at the photographs as I showed you, so that they can start understanding what is expected of them, because that is the only way you can start with a good foundation, and then your assistant can just practice and build skills once they introduce to the live tissue. So learning, for me, my most important thing is critical thinking, because there will be hours of cutting grafts where the person has to be aware what to do and what not to do. They have to be able to self-monitor, and they have to be able to communicate with the physician at any point if they have any questions. So they have to know what is not looking right to ask you that question. So learn what to do, gently handling, keep tissue most, and correct hair orientation. And if they traumatize, they have to know the consequences of their action. If they traumatize the graft, it will end with a result with a kinky hair, dry grafts, poor growth, and incorrect orientation. So the hair curl has a certain orientation. They have to learn to orient the hair in a proper natural look in order to achieve natural results. And so to summarize everything, the phase 1 training was designed to help assistants familiarize with the procedure, instruments. The other thing is to develop awareness and stamina, introduce critical thinking, and expedite overall training period. In other facilities, I learned it takes months and months before someone is trained. We are quicker because we have this pre-patient training that accelerates the movement, hand movement in the period of asking questions, so that when assistants start working on the live tissue, they're more comfortable, and so the acquiring of their skills is much quicker. And we will be at the surgery workshop in St. Louis having specially designed practicing stations for you and your assistant to practice graft cutting and graft placement. And I think that is the most valuable part of assistant training that you can do for yourself or for your assistants, to give them this workshop opportunity to do something they can practice with their own hands. So thank you for your time.